Hello, I'm Dr. Micah Carter, Family Tree Complete Care in Oklahoma City, and today we're going to be talking about low back pain and how x-rays can reveal the cause of the low back pain and when that cause is corrected. So if you'll direct your attention over here, this is the view. It's called the lateral lumbar view. You can see there are 5 vertebrae, L5, L4, L3, L2, and L1. This is from the person's side. We're looking at it from their right side. Now, when we look at this x-ray, what we want to see in a proper, healthy, functioning lumbar spine is we want to see that these boxes, that's the body of the vertebra, just like right here. We want to see that they're nice and square and there's no jagged points off of the ends. Now, we also want to see that the space between them, or the disc, the cushion, is nice and thick. Now, the reason why this spine right here is in such good shape is because the spine is on a proper curve. You can see how the backs of the vertebra line up along that green curve. That is normal. Now, if we compare that to abnormal, this is very obvious because you can see the person standing from the right side and know they're not bending over. This is their back problem. You can see that the backs of these vertebrae are way ahead of the actual normal healthy curve, and that puts tremendous amount of pressure on the bones and on the discs where it shouldn't be. So the effect of that not only is pain, maybe pain down the leg, numbness and tingling in the toes, muscle spasms and muscle weakness, which is, this patient had all of these, but we also see premature aging because we can see degenerative disc disease down here at L4, L5, and L5S1. Now, it's very, very, very important to understand that that is not normal aging. If that was normal aging, then these discs here would look just like the bottom two that are degenerating. This is an abnormal problem resulting from the spine being out of alignment. Now, if we look at the spine from the front, this is the patient's right side, this is the left side. Here's what we want to see. First of all, we want to see that the pelvis is level, that these two bones here, or you can even look out here at these two bones here, that they line up. They're even. Now, if we look at the center of what's called the sacrum, this is the bone that connects your hip bones to your spine, we want to see that that line goes up and all of these dots, the center portions on the vertebra, are lined up right there. That means the spine is in a line. Now, the very first x-ray I showed you and this x-ray I showed you are people that don't have back pain. They're healthy. It's the way it's supposed to be. There's no pressure on the nerves. The muscle is in balance. The muscles are in balance. Now, you can see here that this person's got a major shift. You can see that their pelvis tilts to the right. That's what the red line is. And then all the spine shifts off over here, and the body is trying to compensate. You can see where the red line is. And of course, that's putting a tremendous amount of pressure right there on the nerve roots. And this person right here was having a hard time standing, walking, and sitting because there was so much pressure all the way down into the right leg. Absolutely not normal. Now, obviously, we want to correct this if we can catch it early enough, but sometimes people don't get it fixed, and it can go, oh, by the way, here's another one here where you can see it's on the other side. You can see that the spine comes to the left. But here's what I wanted to show you right here. This is a surgical fusion of a spine that's out of alignment here. Now, this person had disc problems with this, which is pretty common when you have that much unnecessary pressure on the spine there from the spine being out of line. Now, you can see here that when the surgeon came in and they put the screws and the rods in here, they did nothing to fix the underlying problem, and that was the misalignment. So you can see how this is here. So these joints go through different phases of degeneration that takes time. And the degeneration shows up a lot of times well after multiple episodes of back pain. Somebody thinks, oh, okay, well, I hurt my back working in the yard, or I lifted something too heavy, or maybe I had a fall, but I always feel better after a few days or a week or something. Well, that could be true, but that doesn't mean that the problem is fixed. And this is a perfect example of that. So what happens is we look right here, this would be an example of an actual L4, L5 vertebra and the discs here. And we notice the discs are thick, the vertebrae are in great position, they have a lot of space for these nerves to come out. And the nerves go all the way down to the tips of the toes. So what happens here is there are different phases of this premature aging. This would be phase 1. Person might have some minor low back pain. They might not be as strong as they can. They might not be able to stand and wash dishes or work on the engine of their car by bending over. They get fatigued quickly. But what's happening here is you can see that there's thinning of the disc. It's pressing down. This would be the first phase of degeneration, the premature aging. Obviously, we like to catch people in this phase here because we have a greater chance of returning them to this. Now, if it's not caught in phase 1, or if it's not corrected in phase 1, it advances to phase 2. With phase 2, we see the evidence of that premature aging. We see it in bone spurs. We see it in degenerative disc disease. And remember, this is not normal. It might be common, but it is not normal. What happens when these joints aren't moving properly is that the body stops treating them like a joint and it starts treating them like a fracture, meaning that it lays down new bone to try to fuse that. And of course, that decreases the mobility. The people can't play golf, they can't play with their kids, they can't do the sports and activities they'd like to do because they have decreased range of motion, along with all the pain, the muscle spasms, maybe even numbness and tingling. And then phase 2 advances to phase 3, which there's gnarly bone spurs right here. Look how much space there is there for the nerve to come out. Very, very little. There's got to be nerve pressure on that. No wonder why the person with a spine like this would have pain down their leg and numbness and tingling in their toes. And after this is phase 4. Phase 4 is fusion. Look, there's nothing I can help you with in that area right there when the spine's fused. So you got to catch this before. So there you have it, guys. There's some quick information on x-rays for the low back. If you're having back pain and you don't know what your spine looks like or you don't know what to do about it, that's what I'm here for. If you want me to look at it, I'm more than happy to do that. We'll see what's going on. We can even take some x-rays and see where you are along this line here. We want to be able to help you. The sooner the better. The 5 most dangerous words that you can say is, I thought it would go away. Guys, thanks a bunch. Dr. Micah Carter, Family Tree Complete Care in Oklahoma City. Hit me up, ask me questions, put in the comments, cover the page, call, whatever you need to do, we're here to help. Have a great day.